didn't hear anybody, but I'm going to proceed. First of all, thank you very much to the organizers for inviting me to present, and I'm sorry I couldn't actually be there in person. I'm going to finish out today's session with a talk on standards for critical data transmission, and specifically on the ISBT 128 standard in the context of transfusion service informatics. So my disclosure, I'm the executive director of ICBA as an external contractor, and then my organization is funded through license fees and registration fees charged to users and to vendors. So what I will address today or this morning is what are the needs for transfusion informatics standards. I'm going to touch on the concept of traceability, the what and the why. I will give you some insight into what is ISBT 128 and my organization, ICBA. And I also want to introduce the concept of interoperability and why that's important, and then finally point you to some of the resources available should you wish to understand more about the topic. So we've heard earlier from other speakers descriptions and definitions around standards and regulations, etc. I took a very simple one, which I like. It's from the ISO. And this is the idea that standards are a formula that describes the best way of doing something. And it can be about making a product, managing a process, delivering a service, or supplying materials. So I like the idea of a formula describing the best way of doing something. And the previous speaker, Dr. Farouk, went into far more detail on that. Now, in the context of standards specifically for transfusion service informatics, I wanted to suggest a couple of our 4 reasons why this is important. Broadly speaking, I think we can say that standards help efficiency so that they facilitate automatic or electronic data entry. That means that it reduces or eliminates the need for manual data entry, and therefore the risk of human error is minimized. We never eliminate risk, but certainly we reduce it to something that's very low risk. Compliance, as previous speakers have pointed out as well, that standards are often linked to compliance with regulations. So this is a way to demonstrate that you're compliant with international good practice and regulations. Reporting, standards facilitate reporting because it introduces common nomenclature and terminology so that everybody is using the same names and the same terminology to describe the same thing. And then finally, but not least of all, traceability and the idea that, and this is from the AABB definition, and we've heard AABB standards referred to in the session quite frequently this morning. So traceability is the ability to follow the history of a product or service from the source to final distribution or disposition using records. So I had tried to look at the what data using those 4 questions, the what, the who, the when, and the where. And starting with what, standards help us define precisely what is in the bag of blood that we have in front of us. Because of course, blood is a complex substance and it's not simple. So it's very, very important that we accurately define it. We want to make sure that we have accurately and consistently defined or identified the blood group and the RH type as well. We want to know that that particular bag has been uniquely identified with a donation identifier so that, again, traceability is supported by that. The what will also tell us what storage conditions are appropriate for this particular product. And not least of all, it will tell us how much is actually in that bag, so the quantity. In terms of who, we want to know who is the bag destined or assigned to, who is the donor, or bigger pardon, who it came from, the individual who donated, but also it may include information on who it is directed to, the patient. When, it's critical that we know the date and the time it was collected, and also the expiry date of that particular product, and then also where it came from, the collection facility in this case. So I'm going to use a term frequently in my talk, which is MPHO, and I'll elaborate a little bit. But first of all, if you go into Google and you enter MPHO, as I discovered, it turns up a lot of results from South Africa, and a lot of individuals in South Africa have MPHO, or MIFO, I think is the pronunciation for this name. And that is not what I mean at all, of course. I'm talking about medical products of human origin. Blood is one of those, and this is taken from a WHO, so it's an official term. It's also called substances of human origin in the European Union, or in the United States, HCT/P. And this can be anything that is sourced from one person, and that can be transfused, transplanted, or otherwise administered to another person. Interestingly, the name MPHO, or MIFO, actually means gift, and I found this out only very recently in the African Society for Blood Transfusion meeting, where I learned that it means gift in one of the dialects in South Africa, and I thought this was a wonderful coincidence that a donated product, possibly life-saving, certainly life-changing, can also mean gift, and it's something that really amazed me when I made that connection. So I've already referred to WHO, and of course WHO has done a tremendous amount of work over the last 20 to 30 years in the area of medical products of human origin, principally in the area of organs in the early days, but that has been extended then, of course, to blood, cells, tissues, and other substances as well. And in all of these resolutions and guidelines and principles, consistently there is a call for standardization, for the use of common terminology and definitions, and that this is to support harmonized reporting, because one of the challenges of any data gathering exercise is how different countries, or even different establishments within the same country, call things different names. And if we go to the action framework for blood from the WHO, this is the one that should be just concluding, in fact, but I believe a new one is being designed right now. They highlighted the need for information management systems to support data collection, tracking and traceability, and overall hemovigilance. And that standards in these cases would support consistency and comparability of reported information. And consequently, we need those data definitions that they're improved to the point where they can actually support these efforts. And if we look at the region where the Kingdom of Saudi Arabia is located, that's the Eastern Mediterranean region, of course, the strategic framework for blood safety and availability, which it will conclude next year. What was one of the interesting details I found in that strategy was the number one, that they identified the need for national systems for standardized data collection. And they looked at the baseline in 2015, and 8 countries at that time in the EMR region, in the Eastern Mediterranean region, 8 countries had centralized systems. The target for 2025, so that's within the next 12, 18 months, is for 22. And I did have a quick look. I couldn't find actually the progress under this indicator. So it'll be interesting to see what the conclusion on that will be when the framework ends in 2025. So then, to tell you something that I'm sure you are all very familiar with, but I just wanted to reiterate the concept of traceability, and this is the idea of maintaining a permanent, continuous information trail across the entire pathway. And as other speakers have clearly demonstrated, it's a complex pathway as well. And traceability is not sufficient just to be one way, but needs to be 2 ways. It needs to be able to go from the donor to the recipient or the patient, but also back again. And this is in the event of either donor-related issues, such as infections which were not detected prior to infusion, or it could be process-related issues, for instance, contamination in that pathway. Much of this is explained very clearly in a 2023 paper in Vox Sanguinis, and it is not just blood, but in the broader sector of medical products of human origin. But the key elements that this paper laid out were unique identification of each product, secure mapping from the donor, from the donation to the donor and the recipient, and then mechanisms to accurately capture and store that information, preferable use of electronically readable information and data storage, and then the real-time tracking. If we look at the Kingdom of Saudi Arabia, one thing that's interesting, and it's something that personally, being new to the blood sector or relatively new, is the weight of family donors or replacement donors. And this paper from 2022 indicated that approximately, or just over a third of donors in Saudi Arabia are replacement or family donors. But if we look at some of the specific regions within the kingdom, and I'll highlight Mecca there, it's 2/3, and in fact it inverts the ratio. And there may be some thinking that replacement donors and traceability is easy. It's from one identified person to another identified person. But nonetheless, that still entails some risk, and it also perhaps misses the opportunity that standardization offers to improve processes. But I would also say that, and I just highlighted here from the conference brochure itself, which takes one of the objectives under the Vision 2030 strategy for the Kingdom of Saudi Arabia, and that is to achieve 100% voluntary blood donation. So it is to almost eliminate that replacement donor dependency that still exists. And the need for traceability is obvious in that case, where blood is stored and then allocated to somebody who was not identified at the time of donation. And consequently, all efforts that are put in place to ensure robust traceability now will serve to support achieving that goal under the Vision 2030. And linked to that is hemovigilance. And hemovigilance, on the left-hand side, you will see the WHO hemovigilance checklist, national checklist. And there, as you would expect, traceability is highlighted. But a recent report on blood in the Kingdom of Saudi Arabia highlighted that development of a national hemovigilance system and network remains one of the most critical unmet needs for blood transfusion services in the kingdom. And this is in spite of efforts going back over 10 years to actually put in place this system. I understand that progress is being made and that the community is advancing towards this. But nonetheless, again, while that project or that process is advancing, the need for traceability, for standardized, unique identifiers, etc., to support hemovigilance, I think is a clear requirement. So this brings me then to the standard itself and to the organization that I represent. So if I go back to the very beginning of the 1990s, and in a scenario which affected Saudi Arabia directly, which was the first Gulf War, one of the conclusions that emerged after the conflict, and this was in the United States, was that the United States, of course, in their preparations, received blood from many different suppliers. And what they found was that they had a mess. They had different names, they had different identification, they had different labeling systems, they had duplication of supposedly unique identifiers that were perhaps unique in a single establishment or a single network, no longer became unique when they were mixed in with supplies from others. So that was one of the factors that led to the development of ISBT 128. This is the international standard for the transfer of information associated with MPHO. And of course, our origins were in blood, but then the actual standard, the scope of the standard proved sufficiently flexible and robust to actually incorporate other substances. And in the little complex pyramid that you see on the left-hand side, I've just highlighted how the bedrock or the foundation of any standard is standardized terminology. Then as you climb up the hierarchy, you'll see data elements, reference tables, data structures, and delivery mechanisms. And I'll touch on a couple of those points shortly. The other point on this slide as well is that there are two means in which you can transmit this information. One is labels and barcodes, so eye-readable and then scannable codes. And then secondly, and this is a growing area, is electronic messaging, where messages about a given product or this critical data or information can be transmitted through other means, typically through connected information technology systems. So just to emphasize the part played by standardized terminology, and here you can see the current standard, or well, it's from January. It's actually updated approximately every month, but nonetheless, this is one of the recent versions, and it's a long but relatively simple document, and simple in the sense that if you look at the table on the right-hand side, you'll see that we have 3 columns, and this is simply demonstrating how ICBA, using the ISPT 128 standard, offers consensus-based, professionally developed, as in expert developed, common names and database names rather for these products. And that's accompanied by a definition. So this is attempting to represent the state of the art as recognized by the experts in the community of a given substance, and should serve then that everybody actually can agree on using this. And the document itself, as I say, is quite extensive, covering not just blood, but cellular therapy, tissues, ocular, plasma derivatives, etc. So it's a lengthy document, but for this community, for instance, it would be the first chapter would be the most relevant. Second part, and I've mentioned this, is labeling, and the one of the other outputs from ISPT 128, going back to its early days, was standardizing the label format. And in this case, it was divided into 4 quadrants, and each quadrant carries a specific group of information or data that is important for the entire process. So if I just peel away these blue squares, you'll see that in the top right-hand corner, we see the donor identification number. So this is unique. I'll touch on that again. The facility is identified there as well, the collection date and time. And in addition, in this case, you'll see that it says volunteer donor. On the top right-hand side, we here are being told about the ABO and RH type. On the bottom left-hand side, it's the product specific. So if the top is the donation specific, on the bottom here is the product specific. So the code indicating that these are red blood cells, adenine saline, AS1 added. It tells us the dimensions and it tells us the storage as well. And finally, on the bottom left-hand side or right-hand side, we see expiration date and time, and if relevant, any special testing as well. The benefit of a standardized label, of course, is that no matter who is working with it, once they've seen one label, they can reasonably expect that every label after that will be formatted and laid out in the same way, and that speeds up interpretation of information. One key element in traceability and on this labeling system is the donor identification number, and that is made up of 3 elements. Firstly is the facility identification number. This is a globally unique code assigned by ICBA upon registration or upon licensing, and it's associated with a given facility. That's accompanied by the year, in this case the last 2 digits, and then a sequence number that is generated by the facility itself. This combination guarantees that this number will be globally unique, not just unique in one facility or even a country, but globally unique for at least 100 years.
2 minutes, Dr. Eoin.
Yep.
2 minutes.
Okay. Standard delivery mechanisms, we all are familiar with the barcode, and then I want to draw your attention to the 2D or the data matrix, and data matrix is the way to go, of course, because it represents a huge efficiency in terms of the information that we can carry in a single code. Product description codes, these are some examples whereby you can see how each individual combination of one letter and 4 numbers will represent one specific product. The standard has been widely endorsed by the major blood organizations throughout the world. And the AABB standards, which I think are familiar to most people in blood in Saudi Arabia, also have stipulated ISBT 128 for many editions now as well. ICBA itself, we are emerged from the International Society of Blood Transfusion back in the 90s. We have been independent since the mid-90s, coming up to the 30th anniversary now this year. And it's a US-based international non-profit. We are also in official relations with the WHO. And we develop and maintain that standard. We assign that globally unique facility identification number. And the other activities are education, advocacy, and training for our users. We are present, I think it's about 73 countries, or facilities from 73 countries are registered with ICBA. And you can see that we are just over 6,000 active licenses currently. That's just, we achieved that earlier this month. And then the distribution by World Bank regions. And you can see principally it's still a rich world phenomenon. And that's largely associated with the costs of electronic blood banking information systems. In Saudi Arabia, 84 facilities are currently registered, and that makes it the 9th biggest country, single country of countries registered with ICBA. That is principally blood, although some of those facilities included cells and assisted reproduction as well. Interoperability, I'm going to jump through the standard, the definition rather, but it is been highlighted in publications about blood in Saudi Arabia has been the need for national platforms for integration of data, and again, standardization, and again, terminology is key to that as well. And again, looking at Vision 2030, this ambitious strategy, this ambitious plan includes achieving 100% electronic medical records, and that this should include, and if you have the opportunity, please engage with the parts of your administration who are pursuing this, because it's important that they also take into account not just blood, but the other MPHO as well. And in that context, the work that ICBA is doing with our ISBT 128 standard on in collaboration with HL7 on the FHIR, the FIRE protocol, is supports this. Vendors, it's important that vendors are compliant. We issue a certificate to say that a vendor is licensed by ICBA. So any systems you're looking at, make sure that they are actually using the standard. And then finally, under costs, we do charge, unfortunately. It is an organization that incurs costs. The reason for that is while one can establish a standard, once maintaining and making sure that it is still relevant to evolution in technology and science and medicine, as Dr. Farouk also mentioned, that entails a cost. So a typical blood bank a year is approximately $300 to $400. That was probably equivalent, depending on the country, to somewhere between 2 and 4 blood products per year, for instance. More information, a lot of information in the public domain. Please feel free to write to me, and I would emphasize this because I know with so many users of the standard in Saudi Arabia that we have an excellent help desk, which you should avail of. And please don't hesitate to send any queries with implementation or otherwise to them. And I'll close then, and thank you, shukran, and I wish you all a very good conference.